In the world of retinal care, every decision matters. We rely heavily on images, but sometimes they can be blurry or unclear with artifacting, making diagnosis a real challenge. That's where visual electrophysiology testing comes in, giving us insights that images alone can't provide. However, for many years that test was not favored due to lack of modern tools. It seems that this is now changing, as we can see in the rising interest and availability of ERG courses at the EURETINA Congress. This is Dr. Professor Stanga, who will lead one of the 2 ERG courses on Saturday at EURETINA 2024. We are keen to hear why Professor Stanga, despite his extensive experience with most advanced imaging devices, added visual electrophysiology to his private retina practice in London.
I felt a strong motivation to organize this course, and this was out of frustration, because for many years we've been trying to use electrophysiology and it was very difficult. We had to refer the patient to an electrophysiology department. It would take weeks for them to get an appointment. It would take weeks for you to get the report. There is new technology nowadays which allows us to obtain results in total 5 to 6 minutes. We couldn't ask for a better way of getting electrophysiology diagnosis. This course is the result of a need in people going back to electrophysiology. This is going to be a very practical course. When people finish the course, they should have a very good idea of what the technology looks like, what it is like to use it, indications and benefits.
Professor Pojda-Wilczek accepted the invitation of Professor Stanga to share her experience with the visual electrophysiology with various devices in ERG.
The first examination I did in 1987 when I was a student, and it was very hard to perform examination, especially for children. When I start a modern type of ERG with skin electrodes in 2018, it was fantastic for me, and I'm very enthusiastic for this method. In ERG course, I was asked for talk about ERG in optic nerve diseases. It's very important to know that the optic nerve starts in retinal ganglion cells. Examining retinal ganglion cells, sometimes it's very useful in optic nerve diseases, and I would like to encourage examiners to perform it to make proper diagnosis of optic nerve disease.
Join the course to discover how modern ERG can revolutionize retinal care and elevate your clinical practice.